Welcome to Health Done Right. I'm Dr. Becky, the creator of the Science-Based Plan for Wellness. Each week, I'll be discussing how to have a healthy life through healthy eating, physical activity, and behavioral changes. How can something so simple and fundamental to human existence be so darn complicated? There's a lot of misinformation about health and wellness, and Americans don't know who to believe. Over the next half hour, and for many weeks to come, I'll be discussing, dissecting, chewing up, and spitting out the answers to this quandary so you don't have to work so hard at it. This is not an infomercial or a reality show. There will be no magical supplements, no rapid, unsustainable weight loss tricks, just the reality of what you need to eat for health and wellness. Let me tell you a little bit about myself. Instead of a ladder, I've climbed a bonsai tree. In 1978, I entered the medical field as a nurse's aide. Since then, I've climbed to a board-certified obesity medicine specialist and gynecologist. Along the way, I've gathered an AA degree in nursing, a bachelor's degree in biology, a master's degree in psychology, and an MD, and I'm double boarded in obesity medicine and OBGYN. Several years ago, I struggled with my food intake, my weight, and my addiction to sugar. So I started to take the complex classes that are necessary to understand obesity because I found that my patients had the same problems. In the process, I took control over my intake. I lost the necessary weight, and I've now been at a normal BMI or a weight for over 5 years. This plan is science-based. You will learn scientifically proven ways to improve the quality of your life and your overall health. I will detangle the food industry's marketing ploys that tend to interfere or sabotage anyone's effort to try to eat healthily and to have a healthy weight. Each week, I will present two of the four healthy eating options, either a grocery-to-go combo, a lickety-split prepare-at-home meal, a gourmet prepare-at-home meal, or a healthy dining out option. Every now and then, I'll stick in a healthy protein shake replacement meal that can be used when you don't have a lot of time to prepare a meal. Plus, there'll be a physical activity advice, a behavioral change tip. Don't miss the fact or fact section where I'll dispel a common misconception or tell you the truth about a popular trend. Today, we're going to discuss can you make new fat cells? Then story time and the science section, which is where I'll present some latest research to help you on your journey to health. Fact or fat? You can make new fat cells. So in medical school, we were taught that as adults, we have a fixed amount of fat cells and that you don't increase those numbers over time, that they just get larger if you gain weight. When I started taking the obesity medicine classes, I found that the newest research showed otherwise, that actually we can increase our fat cells, the number of our fat cells, and that we can also increase the size of our fat cells. Then when we start looking at the different types of fat cells, there are different locations for your fat cells and different types of fat cells. So we found that the fat cells that are in the belly area or the visceral area are the most worrisome, and that you actually have some healthy fat cells called brown fat cells. I'm going to get to those in a second. So the fat cells that are white cells or adipocytes that are located in the belly area, they are pro-inflammatory. In other words, they cause inflammation, and they can be prothrombotic, which means they can cause you to have clots. So it's the belly fat that we're most concerned about. So most of our efforts are going to be to try to get you to decrease the amount of belly fat. Now, an apple is a delicious fruit, but it is not a good body size. So the apple-shaped body is the one that's going to have more visceral fat or the inflammatory type of fat. And then, of course, the pear-shaped body, there's more weight around the thigh area and the buttocks, which that's not as metabolically active, such as it doesn't have a tendency to cause liver disease, fatty liver disease, high blood pressure, diabetes, as much as the visceral fat. Now, the visceral fat is not the pinch and inch type of fat, the kind of fat that you can reach down and you can squeeze. This is deep to the omentum, or really deep inside your abdomen, where you cannot get at it with liposuction or any of the cool sculpting type of procedures that you see being done to help people lose weight. Then when you look at women and weight and visceral fat, we know that individuals, women are more prone to get breast cancer if they have visceral fat, and that they are more likely to need gallbladder surgery. In menopause, if women gain weight, or even if they don't gain weight, they have a tendency to increase their abdominal fat because of the low estrogen levels. So this is a particularly challenging time for women, and we do know that many women have issues after menopause. Now, I mentioned the brown fat. The brown fat is actually a type of fat that we have very little of as adults. We're born with more brown fat, than that decreases as we come out of the baby stage and get into adolescence and then to adulthood. But we still do have some brown fat, and you can actually enhance or increase your brown fat intake amount by doing rigorous cardiovascular activity. But the majority of our fat's going to be from the white fat area. Once people lose weight, they can gain their weight back very rapidly because these fat cells have just shrunk, and then they can just expand again. So if you gain weight, don't wait to January 1st to start taking that weight off. As soon as you recognize that you've put on a couple pounds, that's the time to start working hard again at trying to decrease your weight gain. The good news is that the belly fat is also the first to come off when you start to lose weight, and this Sana-type fat is also can be shrunk by having certain foods like blueberries and soy and green tea. We know that you can't do spot reduction of belly fat, like you can't do set-ups or any special kind of exercise, except for, as I discussed in one of our previous episodes, you can do the high-intensity interval training, and that's been shown to shrink belly fat a little bit more than any other type of exercise. So get your exercise on. Recipe for health from the Grocery to Go meal combo. Rarely will one particular frozen entree, have enough nutrients and protein and food combo, a macronutrient combo, to keep you feeling full from one meal to the next. So I've put together these meals of fast grocery to go items that you can have available in your refrigerator, your freezer. You can have them at work or at home, and you can use them when you don't have time to put together a fast meal or a lickety split meal. So today I've chosen a Healthy Choice Cafe Steamer. It is a sweet and spicy orange zest chicken. Now, this particular meal I chose because it has white meat, brown rice, and edamame, which is a very healthy form of protein. Now, most of these meals, my experience has been, most of the products have a little bit low. The taste needs to be kicked up a notch. So I'll add either some pepper flakes or some salt and pepper, or if you're trying to follow the DASH diet and keep your sodium content down, you can use a salt substitute. This actually is delicious. The fruit. Now, what I did to show you the difference in the types of fruit. So this recipe or this combo, you can either have 1 cup of fresh strawberries or a half a cup of pineapples. On my plan, you'll have the option of doing exchanges. Let's say you don't like pineapple or you don't have strawberries around the house, and you can easily switch out for one of the other types of fruit. So pineapple has more calories and more natural sugar in it than than strawberries. So this is actually a half a cup of pineapple. I still had to stick with a half a cup of fat-free cottage cheese. Now, fat-free cottage cheese isn't as tasty as cottage cheese that has either low fat or the 4% fat in it. But by mixing in the walnuts and the pineapple, you've then changed it into a very tasty and healthy combo. But we also then were able to get our fats with mainly the monounsaturated and the polyunsaturated fats, which are the PUFAs and the MUFAs. And as you know from previous episodes, those are the fats that we're really aiming for. We're aiming for fats that are high in the omega-3 fatty acids, which of course that's where why the walnuts are so healthy for you. So this meal, does it meet the American Diabetic Diet Association? Check. The American Heart Association diet? Check. The Mediterranean diet? Check. Health done right? You better believe it. Move more, physical activity advice. We recently discussed the Department of Health and Human Resources recommendation for 150 minutes of moderate intensity physical activity per week. We discussed that if you wanted to try to figure out what level of intensity you were at, you could calculate your heart rate and also decide whether you have trouble well, you can actually carry on a conversation, but you could feel your heart rate going up. At this point, you haven't noticed a breathing change. The breathing change comes with a vigorous physical activity. So moderate intensity, you just had an increase in heart rate, but you don't really know how high that heart rate needs to be, which is why it becomes important to be able to calculate your target heart rate. So today I'm going to teach you how to calculate your target heart rate. The first thing you should do is calculate what we call your resting heart rate. So before you get out of bed, before you drink any beverage that has as a stimulant that would raise your heart rate, you should calculate your heart rate. And the way you do that is you take your 2 fingers and you put it on your thumb side of your hand, and you count for about 10 seconds, and then you'll multiply by 6, and that's your resting heart rate. For an adult, your average resting heart rate should be between 60 and 100 beats per minute. For the very physically fit, often they'll have a heart rate between 40 and 60 beats per minute, and that's their norm and healthy sign. So when you're trying to get to your target heart rate, or try to get your heart rate up into the target range, you want to first try to get it into the lower percentage, say around 50 to 65% of your target rate. Then as you get a little more fit, you're going to gradually increase it up until the 85%. Now, with all exercise, you want to start with a warm-up, and you always want to end with a cool down. Those are they're very important. If you don't have this chart available, another way is to take 220 minus your age, and that's usually going to be your maximum heart rate. Then you can do the calculations about 50 to 60, 75% within that maximum heart rate. So look at your age and then go out and calculate what your target heart rate should be and your maximum heart rate should be. Please don't start any physical activity or exercise plan without speaking with your healthcare provider to make sure that it's safe for you to start that type of a program. So aim for your target heart rate. Change your habits, change your life. This is a behavioral change tip. So this is something that's kind of simple. It's the recommendation to eat off of a 9 to 10 inch plate. Back in the 1950s, we ate off of a 9 to 10 inch plate. Since then, the average plate size has increased to about 12 inches. So you can see that the difference in these two sizes would allow for a substantial amount of extra food intake if you use the plate as a guide to how much food to consume. We've actually done an abundance of research on this plate size. It would actually spin your head when you start looking at all of the money and the details and the time that's been done to look at how important the size of the plate is. Even if you're at a buffet, we've shown that if you have the smaller plate, you're going to consume about a third less calories than if you have the larger plate. And there's been a lot of other research on this topic. So try to figure out what you have at home and try to use a 9 to 10 inch plate whenever possible. Make your dishes work for you. Okay, the science of health. A large study showed that there is a 7% increased risk in certain cancers for every decade that you're either overweight or obese. So the World Health Organization has 13 cancers that they have recognized as being a direct link between weight and the cancer risk. This study kind of went along with the same cancer types that they have reported. And the higher your BMI and the longer one is overweight, the greater your risk is for breast cancer, colorectal cancer, uterine or endometrial cancer, gallbladder, kidney, esophageal, stomach, thyroid, pancreatic, multiple myeloma, non-Hodgkin's lymphoma, and meningioma, which is a type of a brain tumor. Sometimes we know what our family history is. Sometimes we know that certain cancers run in the family, and sometimes we actually know the specific gene defect that runs in the family for certain cancers. For example, if you have a strong family history of breast cancer, someone in the family may have already been tested and they're known to be BRCA1 or 2 gene positive. We can't change your parents, we can't change your genes, and we can't change what you already have as far as your genetic predisposition to a certain cancer. But we can affect whether those cancer cells or that DNA are turned on. And that comes from environment, such as what you eat or whether you smoke. So if you know that you have a strong family history of a certain cancer and you know that it's weight related, if you can start working on whittling down with your weight, of course it would be preferable to bring it into a normal range, but if you can just bring it out from the obese down to the just overweight range, you're going to be decreasing your risk of cancer. So do the best you can to work on bringing your weight down, and also trying to look at your family history and see if that's something that runs in the family. Because what we know from our research is that if you are internally motivated, meaning you have a strong reason from inside of your belief system, you're more likely to stick to a plan. So look at your family tree and then start Health Done Right. It's story time. Allie Vincent's roller coaster ride. Allie Vincent was the first female to win the Biggest Loser contest in 2008 when she lost 112 pounds through arduous exercise and anorexic-like eating. Now, she started out at at 234 pounds. She lost 112 pounds, and so by the end of the show, she was down to 122 pounds. Shortly after her win, she started on a program called Live Well Network. And for about 5 years, she had a show called Allie Vincent's Live Big with Allie Vincent. And she began her journey to try to help other people with their weight loss goals. Now, I looked at a lot of her episodes and looked at her recipes, and she spent a lot of time with extreme exercise or over the top type of exercises. She had the Dopey Challenge, where she did 4 races in 4 days for 48.6 miles. She helped somebody run a half marathon, and then she also jumped off of a Stratosphere hotel in Las Vegas. And then she ran 13 half marathons in 2013, and a lot of her activity involved extreme sports. So around 2012, when she stepped on the scales on this show with a doctor there who specialized in weight, and she had gained some of her weight back. At that point, she was at 167 pounds. She was very upset. She was crying. She was disappointed with herself. And he had recommended that she just try to stay at that weight. That if she could stay at that weight for some time, she would be healthier. But she insisted on trying to lose 30 or 40 pounds within the next couple of months, which of course is much faster weight loss than what's recommended. We usually recommend about a half of a pound to 2 pounds maximum per week, and her goals were way above that. Then I started looking at what really happened to Allie over the years and why she gained her weight. We've talked about metabolism slowing down. We've talked about her history of sexual assault. But I think the biggest problem that she had was she put too much emphasis on exercise, and she put too much emphasis on extreme exercise. Instead of just putting in some regular recommendations that come from our studies, where you get a half an hour, 45 minutes a day. Most days of the week, she crammed it into short periods of time and too much at one time. The body does do a protection of weight. In other words, if you exercise too much, your body will stop burning calories as efficiently. And then the other thing that happened, I think, is that she didn't put enough emphasis on her diet. She did have a couple healthy recipes, but in general, she really didn't learn how to eat properly. I feel bad for Allie. I'm rooting for Allie, but right now Allie doesn't have a healthy, happy ending. We're going to stop talking about her for right now, and we're going to go on to Recipe for Health from the Lickety Split meal. Now, this is a very easy meal, and you can use grilled chicken that you grill up, or you can use something you get out of a bag. But I decided last night to grill up my own chicken. But you can buy Tyson's. You just want to make sure they don't have any extra added calories. And actually, in the effort of time, I am just going to, so I don't even measure out salad. Now this mixed baby green salad doesn't look so pretty with the green backdrop here from in the studio, but you're looking for about 3 cups. Then you want to get some fresh vegetables. Again, you're looking to get some volume in your meal. So I've chosen carrots and onions and tomatoes, and then of course we're going to add the healthy fat with the walnuts, and then you want to put on about a tablespoon of dressing. Now, this is Gazebo Room light Greek salad dressing. They use it at the Left Bank in York, and I figure if it's good enough for them, it's good enough for me. You're going to put about 3 ounces of chicken on top of that, and this is a perfect meal. You can have 1 cup of 1 cup of pineapples or 2 cups of strawberries. Does this meet the American Diabetic Association? Check. health done right, check. The Mediterranean diet, check. And the American Cardiology Association, check. So this is a very healthy meal. Okay. Cheers to your health beverage. Sometimes the perfect ending to a long week is hanging out with your friends or having an alcoholic beverage. I'm not trying to encourage alcohol, since this is a reality program or based on reality. We know that many Americans drink alcohol, and we know that many Americans need to lose weight. So what I've tried to do is find alcoholic beverages that will be able to allow you to enjoy the beverage with your friends, but also help you with your weight loss goals or your overall health. This is Mike's Hard Lemonade. It has 5% alcohol in it and about 98 calories. As I've mentioned before, for women, you should only have one drink a day, which would mean one of these, or for men, you can have 2 drinks. So if you're going to drink, do it wisely, do it so that it's good for your heart and that you have it for your health advantage. So cheers to your health. We are at the end of this week's Dr. Becky's Health Done Right show. I hope you've learned some information to take on your health journey. Today we talked about the target heart rate and how that helps you to regulate how much exercise you're getting or how fast you need to work out so that you can get your heart rate up into a range that's beneficial for chronic disease and for your overall health condition. We also discussed the importance of the size of your plate. A 9 to 10 inch plate is beneficial. This entire program has been scientifically proven. Every aspect of this program has been scientifically proven, but the combo of the program on how to eat out and how to eat at home has not been tested. So if you'd like to try a free trial, send me an email at Dr. Becky's Health Done Right, and I will sign you up for the free program. If you have a health question, be sure to send it along, and I'll answer it either directly back to you or on the show. Thanks for joining in. Health is a choice, so here's to your health done right.